Hey YouTube, it's Annabelle. So today I'm going over some breastfeeding topics that I've gotten questions on. And this video is going to be on avoiding nipple injury during breastfeeding or pumping. So these are just things that I have learned personally that have worked for me. Again, my disclosure on all of these videos is talk to your doctor, nurses, and a lactation consultant is the most valuable resource that you can have with breastfeeding questions. They can help you the most and they have heard it all. So again, this is just my experience and what I have learned. Okay, so nipple injury. The things that I am talking about are things such as sore nipples, bruised nipples, bleeding nipples. All of that kind of stuff can happen during nursing or pumping. So these are the things that I have found that work best for solving that problem and preventing it. Okay, so with my daughter, when my daughter was born, I did not take lanolin cream to the hospital. It was not a part of my hospital bag. It should have been, and I did learn that, and I did bring it with my son. So my first thing is to get ready for baby and things like that is make sure that you are bringing a lanolin cream to the hospital with you, or that they will provide some for you to start you off with, because most people have sore nipples right in the beginning. My personal nipples are very sensitive, and with my daughter I got the advice that when I was pregnant to rough them up with towels and things like that, and that did not work for me. My nipples were still super sensitive, and I started off my daughter's nursing in quite a bit of pain because my nipples were so sore. So this time around I did learn, and I did take my lanolin cream to the hospital with me. So that is my first advice. My second advice is I have two lanolin creams, and they both work for different purposes. When my son started to cluster feed and he was on my nipples quite often, this thick lanolin cream from Lancino worked best. For general daily use, the Medela lanolin cream worked best. This one is not as thick, and it goes on a lot quicker, and but this one, if you have severe chapped nipples, sore nipples, and if they are bleeding or bruised, I do like the thicker one better because it doesn't seem to rub off onto your nursing pad. It stays on your nipple better. This one is just for general daily use if there's no problems. I like this one the best for that. Okay, so that kind of talks about, this is the best solution that I have found for that. Now, as for pumping, how to avoid getting blisters on your nipples and bruises on your nipples is to make sure that your suction setting is on a good level for you. If you don't have a plug duct or anything, turn down the strength of the suction so it is just enough to get out to drain your breasts completely. You don't want it on a super high setting. I know a lot of people think that if you put it on the super pull, that it'll come out faster and that you'll just be done quicker and be done with it. But I've had a lot of friends actually injure themselves by having the strength of their suction on their pump set at too high of a level. That actually happened with me also with my daughter. The suction was too strong once we were consistently pumping, and we needed to back that off to avoid that injury, because that will bruise your nipples, it will turn them purple, your nipples might actually start to bleed. And another tip that I can give to avoid nipple injury during pumping is to make sure that your nipple is right in the center of your pump. You don't want it off to the side, because when your nipple is pulled through there, it's going to rub on the side of the plastic, and that will cause injury. So make sure that your nipple is right in the center, so that way it is pulling and there's not, it's more of this back part that might rub. Another thing is make sure that you are not shoving this into your breast, because then this part can also injure your breast. So any questions or comments, leave them below, but those are the main things that I have found to avoid like nipple injury during pumping. With nursing, with like exclusively nursing, my comment to avoid nipple injury on that is pretty much just one, and that is make sure you're not pulling your nipple out of the baby's mouth without releasing that suction first. And that is my best tip for if you are nursing, and that is just if you stick your like pinky finger, is what I usually stick in the side of the baby's mouth and break that seal, so that way your nipple can just come off, and that way you're not pulling the baby off of your nipple. That is excruciating if you have sensitive nipples like I do. So anyways, any questions or comments, leave them below. Otherwise, that is what I have learned on avoiding nipple injury, whether you're nursing or if you're pumping. Bye, guys.